I was born with bilateral hip dysplasia, so both hips, and it's essentially like when the socket doesn't form all the way, so it's kind of shallow. Recently, it was just so painful. I was like, couldn't even climb stairs, couldn't even like walk to the kitchen or walk across my house without being in 9, 10 out of 10 pain every single day.
She has very significant degeneration of her hip joints where the bones, the ball and the socket are just grinding against one another. I first met Kathryn when she was 28 years old, and she was coming with what I would classify as very severe symptoms of arthritis in both of her hips. She had tremendous difficulty even performing the simplest tasks of her day-to-day life, like putting on her shoes and socks or working a full day.
He looked at my x-rays. He was like, thank God you came here, because most people don't have the robotic system.
What we have available here at the Geisinger Health System at large is the Mako robotic technology to assist with joint replacement surgery. That technology for a case like Kathryn's, I feel, is a tremendous advantage. It allowed us, for both of her hips, to preoperatively create a three-dimensional model of her hip arthritis. And so then the act of surgery becomes really just executing the plan that you had made, which allows the surgery to be more expeditious.
It feels like a natural hip. The other day I woke up and completely forgot that I ever had hip problems. And I was like, wow, I wish I'd done it sooner, honestly.